comments about New South Wales needing to stay the course. Are you concerned, though, about the idea of New South Wales easing restrictions when they only have a 50% vaccination rate at the end of the month? I mean, is that going to be a case of cases exploding?
Well, we had a discussion about this today, and I think there's been a mixing of issues here. The national plan, 70% average across Australia, that is when we can start moving into Phase B. And for a state to move into Phase B, which is when there are a different set of arrangements in place and home quarantine potentially, that's being trialled in South Australia, and a range of other issues, including exemptions that may be available to vaccinated residents and things of that nature. Once we get to 70%, and the state also, by the residents' information on the immunisation register, gets to 70%, then that's what that number's about. When a state chooses to impose or lift lockdown, that is a matter, that is a decision for that state. And it always has been. Always has been. In the suppression phase of the virus, then the goal is to suppress the virus, to suppress the movement of that virus, and to seek to reduce those cases as far as you practically can, especially cases that are infectious in the community. That is the goal of the suppression phase, because the lower you go in to Phase B in terms of number of cases that are present, the better everyone else is. Now, we've seen that around the world. So it still remains our goal, particularly in the face of this rather aggressive Delta variant, to ensure that we suppress the virus while vaccination levels are where they are. But as we're hearing, I mean, the vaccination levels are growing every single day. Well, the national plan and the process we have been through does not provide or suggest a vaccination level about when lockdowns lift and don't lift. That is a matter entirely for the state, and they'd be making those judgments and assessments about when they lift their lockdowns based on the medical advice being provided to them by the Chief Health Officer in New South Wales. So it really is a question for the Chief Health Officer of New South Wales. It does not relate to the plan.
Wales to stay locked down.
Sorry?
You're paying the bills for New South Wales to stay locked down. Does the Commonwealth have a view that
lockdown needs to be effective, and when the lockdown is effective, the lockdown can be lifted, and the additional vaccines that we've provided to support New South Wales are assisting them in that goal. But the most effective thing is for people to stay home, to get tested, to isolate, to get vaccinated. There's no shortcuts through this, and we understand that. And it is a heavy burden that is placed upon our nation at the moment. A very heavy burden. And that burden comes as a result of this third wave of the Delta strain around the world. And so as we carry it, we are seeking to assist every Australian affected by this through the significant economic supports which you rightly say are being put in place, and they're put in place swiftly. Australia has been in a position where we have not only been able to save lives and save livelihoods, and as we go towards, even through this most difficult period, this is one of the hardest periods we've had to get through. On the other side of this, hopefully not too far away, is where we have both saved lives, we have saved livelihoods, and we have vaccinated the country. And there are very few countries that will be able to claim those three achievements. But we are very much on our path towards it, and we will keep doing that. But given the lateness of the hour, and I'm sure you've got bulletins to put together, thank you very much.